Nagsimula po ang sakit nitong aking anak sumakit po ang kanyang mga paa, yung mga kasukasuan po na maga. Ang una po namin nilapitan ay neurologist. Kaya po kami nagpunta doon sa neurologist kaagad. Natakot po kami mag-asawa dahil para nga pong kakaiba itong naramdaman ng anak ko. Wala pong nagsabi sa akin na pumunta muna dito sa district. Diretso kaagad po kami sa regional. Iniresetahan nga po ito ng gamot. After 3 days po na ko na hindi nagbabago yung kanyang kalagayan. Parang lumalala pa po. Dinala po namin ng orthopedic. Yun po, ine-request po na magpa-CT scan itong bata. Tapos ang result naman po ng CT scan niya ay okay naman po. Doon po sa doktor, pag check up po niya, sabi po ito di echo naman daw po. Pinaragdasan ulit po ng todo echo. Yan po doon nakita sa todo echo na meron itong sakit na rheumatic fever. 2 months pa po bago na diagnose ang sakit nito. Gumastos po kami ng mga 15,000 dahil po marami kaming nilapitan doktor na hindi pa po kami nakaka-adjust. May mga utang pa po kami sa mga kamag-anak. Mas gugustuhin ko pong pumunta sa mga private doctors. Kasi po nag-aalinlangan po ako na baka hindi po ba masikaso ng husto itong anak ko kung sa mga public lang. Hinihiling ko po na sana matulungan nilang kagaya kung may sakit ang anak.
Fragmentation is the main feature of the Philippine healthcare delivery system. We saw that in the family that was made to spend 15,000 pesos to have their son diagnosed of rheumatic fever by 2 specialists. First, a neurologist and then an orthopedic surgeon, when such a case should have been initially seen by a government municipal health officer. Fragmentation can be seen from several perspectives: public-private segregation, over-specialization, discontinuities between levels of care, fragmentation of public health and hospital care, as well as geographic disparities in quality and quantity of services. To address this, political will must be exercised in order to break down barriers to integration of services. There is a need to revisit the Local Government Code of 1992 and its implementation thus far, with a view to enabling government facilities to be more integrated, efficient, and effective. Government facilities should be reorganized and integrated in accordance with the principles of primary health care based on the Alma Ata Declaration. They should provide integrated health services either directly or through a unified formalized referral system. The Department of Health should have the responsibility for developing and negotiating terms and conditions for installing such a system with the local government units. Our challenge: will you support legislative action to support universal health care, including changes in the local government code, the National Health Insurance Law, and the regulation of health professionals?
Opo, meron po ako iniinom na gamot, mga 1 buwan na ngayon nakakalipas. Umiinom po ako ng leverage kahit wala po akong sakit. Bilang protection na po sa aking katawan. Kaya yung leverage kasi narinig ko na nakikita ko lang sa TV na parang gamot sa ganun. Pero wala naman akong sakit na ganun. Parang protection na yun sa akin. Wala po nakapagsabi sa akin kusang iniinom po talaga yung bilang protection sa aking katawan.
For example, liver aid, yung sa mga taong madalas uminom, parang iniisip nila, may liver aid naman pala eh, may ganyan naman pala eh. Eh bakit hindi pa tayo uminom na lang ng uminom? Pero kasi ako hindi ako naniniwala dun sa mga liver aid o Optin, yung mga supplements for particular organs.
Bumibili po ako dito sa generic pharmacy kasi kaya ko bilhin yung isang gamot halagang 30 pesos. Sa loob ng 7 araw, nagagastos ko lang po is 630. Kung bibilhin ko po sa labas, ang magagastos ko po is 1,000 plus po. Hindi ko po kaya bilhin yun.
Bibiling ko na yung proven na branded. Kasi karamihan kasi ng generics ngayon, madalas, diba, parang napepeke na. Unlike with the proven na branded, there's, mas sure, tsaka masasabi ko, sure siya, kaya masasabi ko rin na hindi masasayang yung pera ko. Kung BFED approve yung bibiling kong gamot, medyo nagdadalawang isip din ako ngayong mga panahon na to. Kasi may times na BFED na siya, may nakakalusot pa rin na mga gamot na nakakasama sa kalusugan ng tao. Dapat yung mga gamot na nakakasama at hindi proven na effective, kailangan hindi na inilalabas.
The public is not protected. What regulators do or not do can cost the lives of people. The system for health regulation has been chronically challenged, can be described as weak, and has not been used as an effective policy instrument. It suffers from two interesting problems. First one, health regulators have no legal protection. A regulator can be criminally sued in his personal, private, and individual capacity simply for performing his institutional mandate. Yet they are not accorded the much-needed protection from many of these harassment cases. They are also subjected to ombudsman investigation based on petty complaints of faceless accusers. A true health sector regulatory reform cannot prosper under this environment. The environment limits their accountability to the public. This leads to the next interesting item, regulatory capture and compromise. Public health issues are often resolved in favor of industry business interests. The full implementation of a DFAT strengthening law should be based on the principle that health concerns take precedence over business interests. Regulatory requirements for quality, effective, and safe health goods should be redesigned to ensure also affordability for the government agencies and accessibility for the general public. Pricing of pharmaceuticals have distorted national expenditures of these items. This leads either to expensive life-saving drugs or their unavailability in the market. In the meantime, commodities that offer false hopes, labeled as health and food supplements with dubious value, dominate our trade and commerce. Health information is often distorted, keeping our population perpetually ignorant and unable to choose wisely. Hence, marketing and promotions for health products should be strictly regulated and misleading advertising banned. Medical professionals need to be reminded that our continuing scientific activities, although known as CME, with apologies, continuous meeting and eating, or continuous partying and eating, at industry's expense can cause high prices of medicine. We urge naive health professionals to behave or be regulated. But I can assure you some of the more mature health organizations have already started self-regulation, and we are gearing towards pharmaceutical independence. Regulatory functions of the Department of Health and local governments should be strengthened to promote the double objectives of our health sector reform. That is, equity and efficacy, which will include the creation of an efficient health, drug, technology regulation that is strongly anchored in science. Our challenge, are we prepared to expand the regulatory function to the extent that if it affects health, marketing is either restricted and false advertising banned?